My name is Micah Derm, and this is a speech to inform for Fundamentals of Oral Communication with Professor Heidi Overstadt. Jumping right into it. Healthcare is simply a human right. Amidst a global pandemic, it's interesting to see how the healthcare system in the United States has taken advantage of its people because of high costs to a nation that claims it is affordable and transparent. In this speech, the cost and affordableness of patient care in the American system will be addressed. I would like to prompt the thought of whether costs should be lowered or if they should remain the same. COVID-19 has recently made this topic more relevant than ever, making many think about the cost versus care analysis. Through the research I have done about healthcare in other countries compared to America, and by living through a pandemic, I am confident to say that I offer unbiased, credible sources and statements. Many of you readers are also currently living through a global pandemic and have some sort of connection to healthcare. This can be through the loss of a loved one, having underlying conditions, or being interested in working in healthcare one day. Either way, healthcare and the pandemic affect each and every one of us in more ways than we can think of. COVID has been making headlines for healthcare since March. Since then, it's been bringing up questions of whether the current healthcare system is doing a well enough job. The coronavirus, or COVID-19 crisis, is about the new unknown virus going around the world causing serious health issues, especially to those with pre-existing or underlying medical conditions. This virus causes damage to the respiratory system specifically, making it so hard to breathe that about 1 in 5 young adults with COVID-19 may require hospitalization, according to the CDC. The virus has a strong negative impact on everyone involved, whether it be directly from contracting the disease or working actively against outbreaks, to those writing legislation to prevent the mistreatment of Americans suffering indirectly. Research done by Warren et al. In 2003, the average cost for a ventilator for patients with pneumonia is about $11,897. I reference the cost to those with pneumonia because it's been noticed that coronavirus patients either develop COVID-19 or have it before they contract the virus. $11,897 is far too expensive for a machine that helps you breathe. The cost should not be this high when costs are either covered by insurance or not covered at all. The outbreak has caused many to either raise their eyebrows or to praise the healthcare system. In light of coronavirus, people are wondering whether their medical bills are so high because they're paying for quality care or because they're paying for hospitals and their workers. A study done by Benau in 2020 revealed that a Nashville-based hospital made a 38% profit increase from the prior year period. This excluding the elective procedures, which had been put to a standstill due to the demand for COVID-19 care. There's an obvious reason as to why paying for hospital expenses can lead to an increase in profit, especially during a time when hospitals are running at full capacity. Yet, there should not be such a great increase when that money is not being reciprocated back into the patients. There's still such a demand for equipment, and this leads one to think, where is my money going? In other countries, the expenses for medical care are relatively low or even free compared to the United States. Let's take a look at the European and Canadian medical systems. The patients are doing well and the costs are lower, Udell et al. In 2012. Found that the European Association of Urology, also known as the EAU, charges less than half as much for expenses for patients with bladder cancer. For a patient of 5 years, the cost comes to around $6,684, including all expenses. For a patient in America, research done by the American Urological Association, also known as the AUA, found that it costs around $14,482 for the same expenses and cost. The difference between the two is astounding. However, in Canada, Morgan et al. Found that there would be a projected increase in government costs from a small number of drug classes. So, with free healthcare comes extra cost. The government costs would increase, which means that the citizen taxes would also increase. It's almost contradictory to lower the costs in one area for them to rise in another. As many are concerned with the economy and the cost of healthcare, we have to ask ourselves, which one is more important? Now that all this information has been presented, looking at both opposing and in favor of sides, it is important to come to a conclusion. During a pandemic, it's easy to see why the hot debate of healthcare and its costs is so relevant. The costs are there for a reason, as they support our economy and citizen needs, but they also cause many people problems. No one wants to prioritize money or personal care, but at some point, it is a question and a reality that needs to be faced. When it comes down to it, this topic is so complex that it's easy to see both sides, but whether you agree or lean towards one side or more, it is up to you.